Hey, good morning, everybody. This is Deborah Even. We are going to go ahead and get started with our clinical EHR training. As many of you know me, not everyone does because I haven't made it to every single health unit yet. COVID put a little bit of a monkey wrench into that, but I will at some point meet all of you. I want to welcome you to today's clinical training and review session. I also want to thank you all for everything that you've done out in your regions. Just showing up to work is a lot because I know that a lot of regions right now have some really high cases of COVID as Region 1 went through a few months ago. So I want to thank you for showing up and for doing everything that you're doing for your communities in your region. As we move back, though, to some clinical services, we realized that there were some things that we needed to refresh, some things that we needed to introduce and perhaps correct in some of our clinical workflows and other things related to Entergy. So we prepared as a group, and this core group includes program leads, it includes our revenue billing team, and our Bureau of Health Informatics folks. All of us got together and develop this presentation today to make sure that we were covering all aspects of what needs to be, discussed, or reminders, that type of thing. So the other thing that we restarted besides these sessions, and we're hoping to do these every couple of months for now, and we'll decide as we move forward, if that's needed. But a part of this, it's going to be very important, is the EMR clinical users work group. We've also got one for clerical users. We have reformed those groups and we will be restarting them. And those groups and those folks in your regions that are your super users are going to be your go-to folks. So if there are things that you find could be improved or that you have questions about how can we do this easier, those are going to be your folks to maybe ask those questions, and then them with your regional nurse managers, and we'll go over this communication workflow in today's presentation as well, will be your point people to get that information back to the core group so we can maybe figure out better and easier ways to make this EMR work for us and not against us sometimes. So the other thing I wanted to let you know is that this recording is going to be posted on Moodle, so we will be recording this, and we're going to post this on Moodle, and we've got some information on a new way we're going to be utilizing Moodle. I'm hoping that as you come across questions, whether you're new, whether you're forgotten how things are done in the system, to please reference your clinical user guide, which will also be on Moodle, as well as the videos, which we will delineate as much as we can what information is stored in there so that you've got the information that you need easily accessible.
Awesome, thank you. Good morning, everyone. For those I have not met yet, my name is Daniela Wilson. I am the Clinical Systems Support Manager in Health Informatics. So as Deborah shared, everything we're covering in this training was identified as some form of opportunity of improvement. And so our objectives for this training are to learn how to navigate Moodle, complete all the required training, view the available resources. So we're going to increase our knowledge on training compliance. We're going to talk about how we're monitoring, what everyone's roles and responsibilities are. We're going to also learn how to navigate all the screens involved in ordering and resulting labs and why that's important. We're going to learn about the importance of timely and complete medical records. We're going to learn the process involved in amending medical records. We're going to learn the procedure for voiding encounters. We're going to learn the importance of having complete patient demographic information and how you can help with that. And we're also going to learn about additional training resources available to you and how to get help when you need it.
Hello and welcome to today's Moodle presentation. Moodle is used for Title X requirements, also for telemedicine, and now for EHR clinical and clerical modules, among other things that Bureau of Family Health uses as well. Some of you may be asking, what exactly is Moodle? Moodle is a learning management platform that's designed to provide educators, administrators, and learners with a single, robust, secure, and integrated system to create a learning environment. Bureau of Family Health is the one program that manages and updates Moodle. The web address is www.bureau bfhtraining.ldh.la.gov. It's recommended that each person bookmark it for easy access to Moodle and to the learning materials. How does anybody get access or a username and a password to Moodle? So when someone is hired in the regional leadership, one of the regional leadership team will complete the link right here below on RedCap, which will automatically be routed to the proper person to add that participant or staff member. Whenever that is done, then each participant, depending on their role in the organization, is going to be assigned to a cohort. And cohorts are just a fancy word for saying it's a course category group. For instance, if their role in the organization is a clinical staff person, they're going to be put into the clinical staff cohort. If their role is clerical, they're going to be put into the clerical staff cohort, and so on. Each module is created and we enroll participants based on their role in the agency. So we'll automatically assign everybody in a certain cohort for that module. That way we don't have to enroll individual people as long as they're in the appropriate cohort. The first thing that the participant will do is they will log in using that web address, and we will email their login information along with a temporary password. One of the first things they need to do is when they log in using that temporary password is to go and change it to something that they will remember. And here are the instructions for how to do that. Once you log in, you'll see the top dashboard and you'll see their name here. You click on this top right blue icon, which will drop down their preferences and they can change their password. We mentioned the top header, and on the top header, once they click My Dashboard, it will come up with the modules that their cohort has been assigned to. If they don't see the module they're looking for, look at the bottom and make sure they don't have hidden courses. If they say that they have courses that are hidden, click beside there, say Show All Courses, and then all of them will be visible in that one dashboard. When you go into your dashboard, each participant will need to click on each individual module to see what are the requirements for completion of that module. Some modules require that a file is uploaded as, for instance, proof that you completed it, or the certificate of completion after you complete something online. And that will have a file submission area here. You can tell that you have uploaded the file and it's done whenever you see that file submission. If you see it like this, where it just has a blank space beside file submission, then you can tell there's no PDF file and you have not submitted. Like I said earlier, this is like a sample for one of the courses that we have for clinical staff. And when you click in it, it'll tell you exactly what to do to complete this course. Click on it, go through it, and then upload your file here. After you upload your file, you'll click Save Changes, and that will save and mark it as complete. Some of the courses do not require a file submission. For example, we've already submitted the file for you as a reference for you to look back at and to attest that you have looked at it and that you understand and agree to follow this information. This serves as an attestation statement. So when you open this file and you review it, if you do not understand the material, you need to reach out to your supervisor for full clarification before you check the box. After you gain clarification from your supervisor, you will then open the file, read, and check the box here. Once this box is checked, that means that you have attested that you are going to understand and agree to follow whatever information is contained therein. If there is a box, that means that it is not complete unless you open the document, read it, and check the box that you've attested. For some videos we do live, and you may be a participant in a live video, but we don't take a roll call. We don't know who is actually online doing that video, so we will upload it to Moodle. And when we upload it, if you have viewed it live, you'll go in, you'll click open the video. You don't have to watch it in its entirety unless you want to watch it again. You can click off and click the button. But if for whatever reason you were on vacation or out that day or working clinic and did not have an opportunity to view the video, at that point you'll click into the video, watch the video, and then click that you have checked and you attest that you have watched it. We will be pulling Moodle reports for all of the different modules. Those reports will be pulled, generated, and sent to central leadership. Central leadership will then forward them to regional leaderships, in which the regional leaderships can help work with all the staff to ensure timely compliance with the modules. Here again is the live version for the demo. You can see where this address is the bfhtraining.ldh.la.gov. Click enter and it will take you to this page. Key in your username and your temporary password, which is given to you in an email from the program. Then you click login. If for whatever reason you forget your username and password, you can click here and you will be able to retrieve either one. Once you log in for the first time, you want to go over to the blue icon with your name, and you're going to click Preferences, and then you're going to click Change Password. Change it to something that you will remember. This is your top ribbon. Go to My Dashboard, and these are all of the modules that you have been assigned depending on your role in the agency. Remember to scroll all the way to the bottom to show all courses. There may be some courses hidden that you're not seeing and you think you've done them all, and they're really just at the very bottom. I'm going to go into the EHR clerical module and show you what that looks like. The first thing you're going to see is a welcome, then any announcements that may be there. And each one of these is going to have a check box. So once you view the website, see what is on SharePoint, you will click that you viewed it. Once you read the user guide and you attest that you have read and understand and agree to follow any information therein, you check the box and continue to do this all the way down. There's your FAQs. Here's some clerical trainings that maybe if you missed, you can tell that I've already opened this and marked this box complete. There's also going to be tip sheets. If you have missed any kind of infographics that might be helpful, you can click in here and you can see the infographic and print it off if you would like. Hit the back button to go back to your module, and you can click this that you've done this. Okay, I'm going to go into Title 10 orientation and show you how to drag and drop a file. Click in the module. Here is where it is going to tell you exactly how to complete the requirements for the module. I have already printed my checklist and signed, and I've scanned it back in my computer. I'm going to edit this submission. Click it, and I'm going to delete that out so I can show you how to re-upload. I'm going to save those changes. Now it's gone. Now I'm going to open my File Explorer, and the easiest thing is to find that file and just drag it over into this box and hit Save. And now you can see that you have that file. Another way that you can add the file if you do not want to drag and drop is to click Add, go to Upload a File, choose File, and this is where you're going to choose where is that file that you want. So you find the file that you want to download, click it, and hit Open, and then upload this file. And same thing, after you upload it, make sure you hit Save Changes. Now that module is complete.
That made it a little more clear on Moodle how-to and also the completion requirements. So now we're going to move ahead and talk about the main reason that we are doing this presentation today, which is that, you know, when we first rolled out the EHR, we knew certain things, right? But as we continue to be on the EHR, we're finding out new things that we didn't know before. And I termed this the missing pieces of the puzzle that we didn't know before, we now know, and we have to get back with all of our users to help complete some loops. So one area of concern was the labs that are not resulted. The second is open orders not closed. And then the third is open encounters not signed. And we're going to be going through each one of these to show how to complete each loop with the appropriate documentation for best clinical practice. So the first thing that we're going to do is we're going to talk about the ordering of the labs. And as a reminder, when you order the labs, you must save between each lab. And that allows the ability to void only that lab, only that one lab, if it gets rejected. When you scan the lab result, when it comes back, if there are charges associated with that test, then the charges drop. But if you don't change the reference date each and every time, then the charges drop on a different date than when the patient was seen. And that causes a billing error, and it causes the insurance to decline that charge. Every time you scan an image, you must change the reference date to the date of service, date of collection, or date of encounter. All of those are the same. The date of service, date of collection, date of encounter should all be the same. Okay, so this is a screenshot of changing the reference date. The reference date defaults to today every time. And so every time you're scanning in a lab, you must change this reference date to the date of service, date of collection, or date of encounter. And you can see on your labs up here at the top, the date of collection, and that is the date that you have to change this reference date to. And it should match the date of the encounter. Many of you may not have noticed when you're ordering labs, but you have the ability to select the due date for any test or any order. By default, we have already preset all orders to have a due date 2 weeks after they're being ordered. And you can see this in the red box right here. But when you order a lab and you know that it's going to take a little longer than 2 weeks, you can drop this tab down and you can move it to the due date that it should be in by. And we know that it can take up to 8 weeks for certain TB labs, like the culture result, drug susceptibility studies, things like that. So you would want to change this due date to what is more applicable for that test. So let's talk about how to view each provider's labs. If y'all will go back and remember back in the day before EHR, each clinic had a lab logbook. And then that lab logbook, you would put the name of the patient, the test ordered. And then when those labs came back, you got your logbook out you would put the results in that lab logbook, and then every day you were looking back to see what labs were missing, and you would probably have to go in and manually pull them from StarLimbs or something like that. So the process is essentially the same. It's just, it's using an electronic process instead of a physical paper logbook. So the electronic logbook is found in the EHR by going to My Day. You go down to Orders, and then at the top of that screen, more in the middle, you're going to find these filter areas where you can filter down to just you as the provider, or the order type, which would be lab or referrals or consults, and then status, which would be you know, if it's been resulted or if it's just been ordered, and then priority, you can toggle there as well. And you use this filter system to go to your orders to make sure that you're looking at your logbook and keeping up with it. And then if you're also assisting the MD or the APRN, you will want to pull their name up so that you can see their orders and help them assist getting all of their orders into the computer. Once the labs or referrals come back, either via fax or email, the first step is to scan the results into Entergy, change the reference date to the data service. The second step is for the provider, or if it's the nurse assisting the provider, to go into the provider's orders and view the result. Now, if that result is negative and the nurse is allowed to sign off the order, then go ahead and sign it off. If the result is positive, then you start the positive workflow. As a note, the CYSHCN MDs must view and sign off all of their orders. So nurses for CYSHCN need to ensure that the results are scanned in so that when the doctor comes back to the clinic, they can view and sign off their results. For reproductive health, the APRN must sign off any orders that are not STD related. For instance, PAP, mammogram, consults, referrals. The APRN must sign off all of those orders herself. The third step is to go into the orders and identify those orders that are past the due date and don't have results yet. So then you would look at those, you'd say, okay, this went to, you know, OPH lab, so I would look in StarLimbs, or this is a PAP that's outstanding, I'm gonna go grab it from CBD, or etc. If these labs were rejected, the order should have already been voided when receiving the notification that it was rejected. However, if you do see it in there, it has been rejected and not voided yet, you can void it at that time when you're looking back at your electronic logbook.
So hey, this is Nora. So as Tammy said, Entergy does not automatically close an order when the image is scanned in. This must be done manually after viewing the result. So after labs are resulted and scanned in, the order needs to be closed. So to view open orders, go to My Day, then go to Orders in the dark side. At the top, you can select the provider you'd like to view. You can also filter down order type and status. You'll need to review the result and close the order. Now for CYSHCN, please assist the doctor with reviewing the lab and procedure results and closing the orders. The nurses should not close the orders before the physician reviews the result. Next slide, Tammy. Yep. Of course, all providers need to sign off on their own encounters, but as Tammy said, for reproductive health, the physician or APRN must sign off on PAP and HPV results, mammogram results, and referrals for non-BP related issues. Reproductive health nurses can sign off and do abnormal workflow for STI labs only according to the STD standing orders. And then for CYSHCN, physicians need to sign off on their own orders. So to view encounters, there are two ways to view encounters that need to be signed off. You can set it up to show in My Day on your My Day screen page by going to Entergy, EHR, Preference, General, and once you get to that General tab, you can go to Open Notes to show My Day and choose All Encounters. And this will enable it to show up on your My Day screen at the bottom right. And that way you always see when you have open notes. You can also find your open notes by going to My Day on the dark side and click Notes, and it'll generate that list on your screen. So I'm sure all of you know this, but as a review, to sign encounters, if you're not already in the note, so say you've gotten out of the note and you need to go back to it, you can double click the blue hyperlink where your patient's name is on My Day screen, review the documentation, and then click Save and Sign, and that'll sign off your encounter. And as always, we really do need to try to sign off our encounters as soon as possible. And this is Deborah. Deborah, you'll need to unmute yourself.
Hey, so I just want to reiterate and stress what Tammy and Nora have just reviewed. It's really important to make sure that our clinical documentation is 100%. First of all, and the most important thing, you know, is our lab results, making sure we get those results in and making sure we close those orders so we know with 100% certainty that we address this for our patients. And then signing off on everything, they've shown you where, you know, the easiest place, you can see it right there, the easiest place to go in and sign off your encounters, and that is really best practice. So assuming we get it all right and we get it all closed, if we come to the point where we realize we've forgotten something, you know, we closed it and your supervisor comes and asks you to correct something on a chart that was already closed, or for you supervisors who are having to do this, and I'm hoping that we will improve to the point where this won't come up, for staff that have left OPH, that we need to correct something on their encounters, we've come up with a new SOP for amending or correcting medical records. So this will also live in Moodle. So we want to make sure that you know to sign in and mark it complete so that you're attesting that you're aware of this SOP. And essentially, it's to ensure that we properly document the healthcare services to the highest quality of care to our patients. And it's also to provide guidance on instances in which an amendment or a late entry is going to be necessary. So how should you document this? I'm not going to go through the whole SOP, the specifics on what does, you know, a late entry mean, what is an addendum versus an amendment or a correction, is all in the SOP. This is just a quick screenshot of it. So what we had to do in the system was to develop a workaround. We tried many different ways to have this show up on the note, which is ideal, and it should be on that encounters note. And if you go to the next screen, please, Tammy. And what we've come up with is this little blurb, and it'll be a checkbox, and it should be on all of the forms that you use currently. If you do not see it, please let me know so that we can add that. And it's called Amend Note. And so there's a checkbox there, and you need to open up the little box to the right so that you can free type in. And you see in the parentheses, you know, name, the encounter date, those things you're going to need to type in. And what we want to do with this is to make sure that anyone who's reading this record afterwards understands that you as a provider or supervisor on this date amended what it was and the reason. Now, Entergy will mark in red on the note that the note was amended on X date, but it never did tell us what was amended. So this is our workaround to correct that. Now, the only issue with this currently, and I don't see any other way to amend a record, is the signing off. So stay tuned for being able to sign off on that, because again, with Entergy and with a lot of EMRs, you know, we always run into some challenges. But this is the best way for us to see directly on the encounter note what was amended, by whom, and when. And I want to make sure at this point to pause and see if there are any questions on anything that Tammy covered with Moodle and what and the orders and what Nora covered with signing off, or what I just covered. Are there any questions at this point from anyone? You can type in the chat or unmute yourself. Okay, so we will continue. If you have any questions, please type them into the chat, and I'm going to turn this over to my colleague Angela Blanchard from our TB program.
Good morning, everyone. I just have a few topics to cover for TB. The first one is OPH employee health screening. Not every OPH employee is screened for TB annually, but those who are at highest risk are, and neither the patient nor the insurance of that patient, which is the employee, should get a bill for TB services. So we have to do a workaround for this, because originally we made this a non-billable encounter, but in Entergy, a non-billable encounter does not necessarily mean that a bill is not going to be sent to insurance or the patient. So it's going to be a billable encounter because you're going to have either a lab, which would be the T-spot, or a procedure, a PPD, attached to it. Both of those have charges. So it has to be a billable encounter because it has those attached to it. So the workaround is at check-in, the clerk should register the employee as self-pay TB, and the abbreviation is SPTB. That has to be listed as the primary plan code for that patient's insurance and patient information. Now, any follow-up that's done for a positive T-spot or reactive PPD, and the patient has to be seen in medical clinic, there are no bills for services generated thereafter throughout evaluation and/or completion of treatment. So it's going to always be self-pay TB for employees who are screened for TB and/or treated. And on the super bill, what you should see is the diagnosis, the T-spot, and the PPD. No E&M code is associated with this encounter. So any patient that is seen in TB clinic should never receive a bill for out-of-pocket expenses. If the patient is insured, the insurance or Medicaid will be billed, but the patient will not receive any a bill for out-of-pocket expenses. So if a patient comes in that is uninsured, same thing, clerical is to select SPTB as the primary plan code for insurance, and that's the workaround for a bill not being sent to the patient. So the purpose of this screen is to remind you that if a lab is ordered but not done, that lab needs to be voided from the encounter. And for TB, most likely, we would more than likely see this for drug susceptibility studies. So if the final culture comes back showing TB, then a reflex test is done for drug susceptibilities. If there is no growth of AFP, the final culture is negative, then drug susceptibilities are not done. There's nothing to run it on because it was negative. So go back to the encounter when the drug susceptibilities were ordered, which should be the encounter when the initial sputum was collected, and void the drug susceptibility orders on that sputum. When you're entering a lab result, that is when charges are dropped and a bill is sent to insurance. So if you have a self-pay TB primary insurance plan, it should not bill insurance. So for those orders, for those encounters that have already been done, and we didn't know that, to put the SPTB for uninsured patients or for employees being screened, when the nurse is entering the result, go in and look at this screen, which can be accessed from either Entergy EHR or Base Entergy. And if you click on Personal, then Insurance, you can see which insurance is made primary, and you should see SPTB right there. If you don't, go ahead and first result your lab, save it, close it, complete the entire thing, and then go to your clerk and tell them that they're going to have pending charges for that encounter, and they need to go in and change the plan code to SPTB so that a bill is not generated for that. And that's all I have. I can.
Right. Angela, we do have a few questions in chat for you.
Okay.
The first one is it okay for a DIS supervisor to result out sputum results for a field DIS?
No, we need to make sure that the nurse is putting in all results. However, you have to keep in mind that TBDIS absolutely need to know the results of those tests because they do case management in LATB, which is a computer program statewide that can be accessed from all providers all over throughout the state, and they have to make sure that the case management system is up to date. So they do need to get those results, but the nurse is the one responsible for entering results and signing them off.
All right, and the follow-up question to that is, what if the DIS is the one that ordered the sputum?
Well, you can only sign off on your own orders. So from here on out, the nurse is the one that should be placing the order and signing. You should sign off your own orders. So if DIS placed the order, then yes, they need to sign it off. But again, the nurse needs to be made aware of those results. So it's collaboration between the nurse and the DIS. The right hand needs to know what the left hand is doing. So either way, communication needs to flow.
Okay, another question is, how will we fix all the T-spots collected already this month? Nicole's saying, I just did it as a non-billable encounter.
Okay, so the fact that you created it as a non-billable encounter is negligible. That does not need to be changed. And that was my error in the beginning, telling you to create it that way. But that's changing. It will now be created as a billable encounter. But you don't have to go back and change the type of encounter that it was if you had created it as a non-billable. But you do need to go in and look at what's the primary plan code, and if the patient is uninsured, it should be SPTB. Or if it's an employee, it should be SPTB.
All right, any other questions for Angela? Either put it in the chat or you can unmute yourself now. And if not, we will move on to Laura with voiding encounters. And Laura, reminder, unmute yourself when you're ready.
Thanks, Nora. As many of you know, unlike the success system, Entergy does not allow us to delete any encounters. There's now a new process for voiding encounters. It's actually more than a two-step process, I should say. But unlike success, the first step for this is to contact a provider. If you notice that you have a duplicate encounter, you will be responsible for doing all the void of information on that encounter before the entire encounter can be voided. You usually start by selecting your encounter. You can go to the patient encounters on the dark side, look for that specific encounter and click on it. And this will take you to the summary page for that encounter. Next slide. Thank you. This will show you some blue hyperlinks of all the items that are on this encounter. This is a good way if you have done several of your voids, for example, the orders and tasks. You have voided those items and you're not sure what the medications were attached to this encounter. You can always go back to this summary screen and look to see what is the other items that you need to void on this encounter. All these items will have to be voided before you can void the note. And you cannot void an encounter until the note has been voided. So the first step is always to check here, see the items attached to this encounter so that you can begin to void all the items related to this note. First step would be to void your vitals. The easiest way to do this is to go to your note itself. You can access your note, of course, off the top ribbon. Once you are at your note, you will locate the vitals on that note itself, right-click, and you will select Void. You can also access your note, of course, by the dark side, just going to the actual document of that note. But none of the void information can be done until everything's removed. So if you have vitals, they have to be removed from the note itself. So you will have to access your note and right-click and void those vitals. It will not allow you to void any note that contains vitals. If your note is signed, you will have to do an amendment in order to access the note and remove this information. The same with orders. You can access your orders, of course, from the black bar on the dark side. Usually the entry itself in the blue information, if you locate the order that you need to void, you can right-click on it and select Void. If that order has been closed, you will have to edit the order in order to be able to void it. So you will need to access the edit button on the top right. Once you've opened that order, you will see the void at the bottom of your screen. It will, of course, give you a confirmation screen and ask you to confirm that you, in fact, want to void this order. As you select yes, that order will, of course, be voided. Same applies for any administered medications or regular meds that were entered. These all must be voided as well. So you can access your administered meds from your RX on the dark side, locate the medication, right-click. You will see the Void RX option. Same for your regular medications. Go to your medications, locate it. You will right-click and you will say Void the prescription. You have to do this for all medications as well that are attached to your encounter. After you have voided all your labs, orders, medications, removed vitals, that's when you should be able to void your note. Easiest way to void your note is to go to the docs, locate that note itself, right-click, and you can select Void. If that is grayed out, you may either still have items that need to be removed or your note's not signed off. If you have had to edit that note in order to remove your vitals, you're going to have to sign it off again before it will let you void it. So if it's grayed out, go back to your chart view, review it to ensure you have removed any items attached to that encounter. Navigate back to your note, ensure that you have saved and signed that note after the removing of the vitals. Once all of that is done, you should be able to select your note from that dark side and right-click and void. Once that's done, if it's a, sorry, Tammy. Once you have voided that note, what happens next will depend on whether or not there are charges related to this encounter. Next slide. Thank you. If it's a billable encounter and it's less than 48 hours old, You will send that information to your regional nurse manager or the appropriate staff in your region to have any of the charges related to that encounter voided. If that encounter is older than 48 hours, you will need to send in an LDH service ticket for our revenue team so that they can address those charges because they will have been billed out by that point. Please be sure to include your patient's ID, the encounter number, and the date of that encounter on any service tickets you send in related to those charges. Once the charges have been resolved either by the revenue team or by your appropriate staff in your region, you will input an LDH service ticket to have the encounter voided on the base side. Jeffrey at our help desk will take care of that, or one of our EHR team. But once everything has been removed and voided, that encounter, in order to not show up in your encounter list, still has to be voided on the base side. So you'll need to input a help desk ticket, give us the patient ID, encounter number, and date so that we can void that encounter on the base side, so it will be removed from your list of encounters on the EHR site.
Laura, this is Angie. Can I add something right there, please?
Yes, ma'am.
For the question I had a while ago about the T-spot that was resulted on that non-billable, I had a question yesterday pertaining to this. So obviously the encounter would have been more than 48 hours ago. So if there were charges that dropped when you resulted it and the insurance plan code was not SPTB, then you'll have to put in a help desk ticket so that the revenue team can see about the bill that was probably sent to insurance.
Yes, that is correct. If the charges have already dropped and it's been more than 48 hours, that needs to be reviewed by our revenue team to verify that those charges have not been billed out, or if they have, for them to be able to reverse any of that, send in any information that needs to happen.
So before you move forward, Laura, we have a couple of questions in the chat. The first one is the EHR help desk ticket is only if the encounter is greater than 48 hours, correct?
The service ticket for the encounter greater than 48 hours, there would actually be two. The first one is going to be for the revenue team to address those charges. If it's less than 48 hours old, you will still need to input one to have it voided on the base side. So it really depends on the age as to whether or not revenue has to take a look at those charges on that encounter.
Okay, and we have another question for you, Laura. Can additional staff, such as nursing supervisors, have permission to have charges voided?
That is a question I'm going to defer to Deborah.
I believe Deborah lost her Zoom. She's trying to get in right now. I don't know if she's back, but we might have to get back.
This is Dana. This is Dana. Some of them already had access. Some of the supervisors already had access from when we did a project. So I'm sure that it will be okay for that to occur. I just want to also add that if it's within the 48 hours, the reason why you guys can do the void at the regional or the clinic level is because the journal is still open. The journal encapsulate all of the charges that are going to be billed to the insurance company. So once that journal is closed, then that's when we know that the insurance probably has already been billed, and we would have to be able to get with the insurance company in order to avoid those charges.
And then it looks like she has a follow-up to that. Who do we send the request to for additional permissions?
I would say any requests like that need to go through Deborah, but since she's not here to speak for herself, can we defer that until she is back with us, and then we will.
I'm back.
Oh,
I'm back. Yeah, that's fine. That can come through me.
Okay, perfect.
Welcome back, Deborah.
Thank you.
Any other questions for Laura before she moves on to patient demographics? Okay, go ahead, Laura.
All right, patient demographics. We are doing a training for our clerical staff this afternoon, and this is one of the, hello? This is one of the items we're going to cover with them. For our clerical staff, there will be quite a bit of detail for going over items within demographics that we need to be sure they're capturing accurately. One of the important things for y'all to know on the clinical side is why this is so important. One of the most important reasons we're looking for accurate demographics is for matching patient medical records. That's not only for ensuring that we do not have duplicate records within our own system, but for transmitting information to other providers for use of the health information exchange, and to ensure that we are accurately recording and reviewing our patients' care. It makes it very difficult to match up records and to ensure that we have the correct information as far as their historical care if we have errors or missing information. When we have a complete picture of their care, of course, then we're aware of any labs, diagnostic tests, medications, or any conditions, allergies, etc., their medical history, their family history, all of that is encased in an electronic health record. If we have multiple records for the same person, you are not seeing the complete picture of that person's history and care they have received. So, of course, that can adversely affect the care they're receiving now, and it also affects their privacy because their record is not one contained record. So if there's for example, a mismatch in the name and you pull the wrong record and start entering someone else's history on that, well then a provider could, for example, be asking someone about an issue they had in the past that doesn't even belong to that patient. So there are risks to patient privacy as well as continuity of care. So for your part in how you can help us with demographics and ensuring that we have accurate information. Next slide. Thank you. You can view the demographics for your patients. Go to the dark side and information. You will see a short section at the top with the patient's social security number, phone numbers, the recorded example. And right below that, you'll see the More button. If you click on that More button, you will see a more detailed listing of the information we have recorded for that patient. One of the big highlights we're pointing out to our clerical staff is that social security numbers must now be left blank if we do not have an accurate number for them. Previously in Success, I believe, we were entering all nines because the system had to have an SSN. That is no longer the case with Entergy. And entering those all nines for an unknown social security number is causing issues with our billing. So we are now going to require either an accurate social security number or that field be left blank. As you can see in the screenshot on the right below the text, there's social security number. So you can verify that that is not all nines. That would be extremely helpful. In addition, of course, you can check for gender identity, sexual orientation, addresses, correct names. All of this information that you can view here will not only help ensure that we have a single record for each patient and that you have the entire history on that patient. But as we move forward, we are of course going to once again implement a patient portal. Patient portal is going to require that they know specific information as it's entered in our health record. For example, their social security number, their zip code, their date of birth, their first and last name. If they go by Roger and we have them listed as Michael, they're not going to be able to even sign up for the portal. So as part of that portal, there will be certain fields in the demographics that we need to verify with those patients before we add them to portal. So you being able to access this demographics from within the EHR side and maybe do a quick review, ensuring that, for example, the social security field is blank or contains an accurate number. verifying that the age, the sex, the gender identity, those fields have been completed. If you notice, there is either the issue of all nines in the Social Security number or some missing fields that should be recorded either for Title 10 or because of upcoming portal. You can certainly send a task to your clerical staff or just walk over and talk to them and say, hey, I noticed that this is still all nines. We have to remove that. That'll help us all get on the same page, help us start merging records so we have one complete record for each patient. And as I said, soon we will be implementing our patient portal, so accuracy in our demographics will be important for that as well.
Laura, you do have a question in the chat. When will patient portal be ready for patients to use?
Our go live date is currently set tentatively as August 18th and 19th, the week of the 18th. We will certainly get out additional information very soon regarding that. We have had to push that back, as you are aware, several times due to COVID and just staffing issues and having everything set up. But we are expecting to activate patient portal and messaging the week of August 18th.
Another question is there an easy way for us to correct errors from this page?
No, not to my knowledge. I can certainly check into that to verify that, but as far as I know, this is view only. It is not editable by you.
And then we have another question. I am still seeing the code in the procedure history that needs to be removed. Help desk was notified. The encounter had to be changed to non-billable for that particular date. Does it take a few days to not see this code, such as a no service code, or what happens next?
If you have a service ticket in on that, if you can just shoot me a quick email with the service ticket number, I will take a look at it for you. Especially if it's a no service, we should be able to go in and remove that no service code so you can void it. So I'll take a look at that for you.
And she says, okay, and it looks like that's all in the chat. Anybody have any other questions about this? You can unmute yourself now. And if not, Laura will move on. It looks like no other questions in chat, Laura.
Okay, perfect. We will move on then to additional training resources. Currently, with the implementation of Moodle, we are going to, of course, add this training video to your Moodle. So that would be the first place you would want to look. If you have additional questions, maybe go and review the video for today's training. In addition, there are specific sections within your clinical user guide. The revision date for the guide used for this slide is July 2020, and any related SOPs. We've listed the page numbers here, and in addition, this document is available under the resources in your clinical module. So you can pull it up, look at it, check those page numbers, review that information there. Of course, we have the VIA learning platform from Greenway. There are some videos related to these items that we have presented today. There is a document, of course, in your resources on Moodle for how to access those trainings and how to search for certain videos, certain classes. You can, of course, self-enroll yourself into any of those courses. We have listed here as well the particular videos that we have found that would relate to this, such as how to void your encounter note, how to amend an encounter note. And these, remember, all these videos are just a broad overview. They're not specific to our system, but will give you the step-by-step guidance for exactly how those processes work. So you may find those helpful as well. And as I said, this additional training information document is available in Moodle under resources, as well as the documentation for how to access your VIA trainings. Anyone have any questions on that? All right, then I believe I'll turn it back over to Deborah.
All righty. I think there was one question about whether or not this would be available for clerical staff. And I believe if you're in Moodle, and Tammy, I don't know how exactly this works in Moodle, will clerical staff be able to see clinical, or is the cohort going to prevent that?
So clinical trainings will be under the clinical module. Clerical trainings will be under the clerical. However, I will bust this training up into individual videos, which is going to be on the video resource library. So if they need to see just about voiding encounters, they can go into the video resource library and view just about voiding encounters. If you need to see just about Moodle, you can go into the video resource library. But to view the entire training, that's going to be under just the clinical.
Okay, great. Thank you for that answer. All right, let's move on to the next slide. So another aspect of making sure that you have the answers that you need when you need them was to kind of delineate, what the communication flow should be. And so this slide will be uploaded. I know it looks like a busy slide, but it was really necessary to do this so that we could, outline, if you have a question, where do you go next? And that really asks, the next question was, well, what kind of question is it? So this really outlines, if it's a certain type of question, and my colleague from BHI, Kenneth, will go over, the help desk type of questions. The rest of the questions should go to your super users, and we're really envisioning those being, straightforward. Obviously, in this instance, you should be very comfortable, with Moodle. As Tammy mentioned, please bookmark it. That is where your clinical training guide will live. And keep in mind that that is going to be a living document that will be updated, as we need to update it so that we're incorporating everything in there. And our EMR super user work group will also be helping us fine tune it. And it can be a big document, but those documents are really designed. If you go to the table of contents and click it, it should jump straight to that section. And so we've outlined the flow here. First, super users, and obviously the clinical user guide. And then from there, if it's suggestions or if it's something that, isn't clear at that point, then that would go to your regional nurse managers. And this is how your information or your questions or concerns will flow all the way up to our steering committee. As we make changes and as we update things, everything will have to go through the EHR steering committee, which includes more folks than are actually on the phone today. And of course, in accord with, programs and regional leadership, so that everyone has visibility on things that we are changing. It's got to go through that process so that we are all on the same page. I know at the beginning we were changing things from one day to the next almost, but we have tried to get back to, the way information flows. So that's what this document will be. So use it for when you have a question and you're not sure where it goes, or you sent it to someone and it was supposed to go somewhere next, but you're not sure where that went. And certainly we want to keep your super user list updated, and the chairs and co-chairs as well as your regional nurse managers should know where things stand. If not, they can find out for you.
Okay, so as Deborah said, super users are always going to be an extremely helpful source. There are going to be some instances, however, where you're just going to want to bypass your super user and directly create a help desk ticket. The three instances that I have illustrated on the screen are anything related to hardware, such as your computer won't start, or other basic functions that exist outside of Entergy that are hardware related. Printer won't turn on, things of that nature. Those become a help desk ticket right off the bat. They're routed to OTS, and OTS will address that. Lockouts of your actual computer or your Entergy or Citrix passwords, create a help desk ticket. That way we can get you back in, get you working as soon as possible. If your internet is down or you have a slow connection, once again, that's just directly to OTS, and you can find 3 separate ways to create a help desk ticket here. OTS recommends that you either do it online or via the email for fastest response. Obviously, if your internet is down, phone call is the way to go. Next slide, please. Now, there are going to be some times where you will either need to consult a workaround, a user guide, or complete a form before creating a help desk ticket. One such example would be the patient merges. There will be a guide stored on Moodle that gives you step-by-steps on everything that must be completed before you submit your help desk ticket for a patient merge. If you do not complete that guide and you submit a help desk ticket for a patient merge, we're going to send you that guide and we're going to tell you you have to complete it before you get that patient merge. So please make your job easier, make our job easier. Always go and consult that guide for things that need to be done. Scanner issues. I know that scanner issues are still a big problem intermittently across the state. We have a lot of individuals that are still attempting to scan directly into Entergy. I'm going to once again say consult that scanner workaround because that will work every single time. If for some reason it does not, that is typically something that is related to your session, and thus you will have to create a help desk ticket, and then we have to go to Greenway to get your session cleared. But if you're having scanner issues, once again, first consult that workaround. It's a one-pager. It should also be on Moodle. Now, when we get to requesting a new user, this is often going to be done at your RAM level, but a new user form must be completed. We're often getting just emails saying, hey, I've got this person and I need to have access for them. Well, we can't do anything until we have that completed new user form. Those are also found on Moodle. So as you can see, everything that you need in terms of self-help or resources to complete before putting in a help desk ticket for some of these listed items will be found on Moodle. Next slide. Now, there are a couple of instances, as shown here, where there are additional steps. Voiding encounters we just went over, but once again, the user guide. If for some reason that user guide is still not quite giving you the assistance that you need, then you go to your super user. Hopefully, you'll be able to get through with the user guide, but we do understand that occasionally you might need a little additional help. Go to your super user. If your super user can't do it, there's probably something going on that we need to be made aware of. And that's when they would create the help desk ticket. And finally, this is the last one is sort of a catch-all because naturally we couldn't list every flow for every potential problem. So we just sort of gave you the overview on the most common. But if you're having an issue performing one of your standard job functions, first thing I would recommend is just reach over and ask a coworker because chances are good you might have just forgotten one little step. They'll be able to give you a quick prompt, oh yeah, thanks, and you can move right along. However, if that's not an option, you're the only one in the clinic, or they're confused too, consult the user guide. Once again, it's a living, breathing document. It will always be on Moodle. You should be able to find the answer. If you can't, that goes to the super user. The super user, once again, will go up the chain and attempt to find an answer for you. If they cannot, then they're going to create a help desk ticket. And we can then, okay, let me see. We've got a question. Can IT fix problems with Entergy such as error messages that prevent access to the charts? Or would that be a Greenway problem? Sometimes those error messages are things that are being caused by user error, individuals that are perhaps doing something incorrectly, or the error message is actually telling them exactly what to do, and they're choosing not to for some reason. Other times those error messages are error messages that are session-based, and that is a Greenway issue. So I would recommend, in that case, once again, consult your user guide, consult your super user. If those two do not provide you the answer, then by all means, put in a help desk ticket, because until we actually see the error message, I can't tell you whether it's specific to the user, specific to the session, or perhaps it's a system issue as a whole. So that's sort of your very brief summary, and I tried to catch as many of your standard issues as possible. In that last slide, we reiterated all of the ways that you can contact the OTS Help Desk. You will be able to have this slide deck at a later point, so you can go there if you don't already have them bookmarked.
So a couple of things, a couple of other reminders. We do, as I mentioned earlier, we do have the clinical user guide in Moodle. It is a living document. It's something that will change as we figure out things in Intergy, as that, you know, every EMR makes updates, so things are going to change. I would encourage you, given how large the document is and probably will be, not to print it. I would encourage you maybe to save it to your desktop, but, you know, for ease of use. But please be aware that, you know, as we change it, you know, things might get tweaked, pages might be moved. So we want to make sure that you find the best way to have the most accurate document, you know, where you can access it. So if that's saving the Moodle and then going through it that way, or, you know, we will definitely alert folks when, you know, the user guide has been updated, then that's what we would, you know, recommend, as opposed to printing, just because it will change. Although we will we will finalize for the moment, and then maybe in 3 months it might get updated.
Deborah, can I just jump in real quick?
Yeah.
An additional benefit to keeping the electronic version on your desktop or accessible in some way other than a paper is you can do a search. If you just hit down Control and the letter F, that will bring up a search box, and then you can type in any word that you might be looking for. So you can kind of think of keywords, and you can type in that word, and it will then produce a list of every instance of that word. So you can quickly sort of jump through that document to try to find what you're looking for. So you don't necessarily have to scan the entire document.
Correct. Thank you for that reminder, Kenneth. And I believe Dana wanted to mention one last thing regarding the SOP.
Yes, thank you, Deborah. I just wanted to ask you guys to make sure you read over that SOP again. It's important just because the information that came over from Success as it relates to medical records came over as an image. And if you're making any corrections to anything that came over from Success in that image, it's going to be handled as a paper claim. The revenue team has held out sending any of those things to the clinical team because we didn't have this SOP. And so now that we have it, we will start sending out requests for review of coding that's related to those things that are those encounters that occurred in Success. Thank you, Deborah.
Okay. Are there any final questions on anything that was presented today? Anything you want to bring up? Anything you want to discuss? Now is the opportunity. We still have time.
And as you're thinking of questions, I will be launching the poll. The post-clinical poll is basically the same questions that you had in the beginning, but if you could please answer them again so we can measure the success of our training.
Just as one of the final reminders, I do want to let you know that all of this, the document, the PowerPoint, the videos going into the library, all that will be done by the end of this week. Give me a couple days because I have to snippet all of the videos into separate segments. But that being said, by the end of the week, you should go into Moodle and attest that you were part of this training. We appreciate you being here live. I think you get so much more live than you do with a recording. But for those who have not been able to join today, let them know that this recording is going to be on there so that they can go and listen and see everything that they missed. For those of you who may not have seen on the chat, the way that you're going to know a document has been updated is there is a way to mass mail all participants for a course, and I'll send that out whenever we get everything uploaded so that you don't have to constantly be going and reading the same document to make sure nothing's changed. We will let you know when something's changed, but we do want you to get into a habit of going into Moodle and seeing the latest and greatest right there, because sometimes emails can get confusing as to what is the latest and greatest. So we're going to house everything on Moodle for that convenience.